Hi, my name is Tran, and today I will be discussing the autism spectrum disorder. We will be going over what is the autism spectrum disorder, the prevalence of autism, what are the risk factors, what are the treatments, some resources one can use to help family members with autism, and the resources I have used in this PowerPoint presentation. What is the autism spectrum disorder? The autism spectrum disorder is marked by two main symptoms: problem with the person's ability to relate to others, and having a fixed set of interests or repetitive behaviors. Remember that the autism spectrum disorder is a range of abilities and traits, and that no two people reflect the disorder in the same way. There are three severity levels of the autism spectrum disorder. Level 1, requiring support. Level 2, requiring substantial support. And Level 3, requiring very substantial support. These levels are correlated with the two symptoms of autism: the severity of a person's social communication abilities and the severity of the person's restrictive repetitive behavior. Now, let's take a closer look at the social communication severity levels. At Level 1, requiring support, this person may have impaired social communication that causes clear problems. While the person may speak in full sentences and engage in communication, they may fail in back and forth communication with others. Level 2, requiring substantial support. This person has a clear lack of verbal and nonverbal communication and speaks in simple sentences and has very odd nonverbal communication. Level 3, requiring very substantial support. This person may have a severe lack of verbal and nonverbal communication that causes severe problems in social interactions. This person may speak very few understandable words and rarely start social contact. Now let's look at the restrictive repetitive behavior severity levels. At Level 1, requiring support, repetitive behavior causes great interference with daily function. This person may have trouble switching between tasks, and also problems organizing and planning that may hamper that person's independence. Level 2, requiring substantial support. Restricted and repetitive behaviors occur often enough to be noticed by the casual observer. Distress or frustration is clear when behaviors are changed or interrupted. Level 3, requiring very substantial support. Preoccupations, fixed rituals, and or repetitive behavior that disrupt all areas of function. This person becomes very distressed when rituals or routines are interrupted. Now let's look into the prevalence of the autism spectrum disorder. This table has been taken from the Centers for Disease Control and Prevention. Now, according to the Autism and Developmental Disabilities Monitoring Network, as you can see from 2000 to 2014, the prevalence of autism is now growing. Before, in 2000, 1 in 150 children would have autism, and this number becomes more prevalent as the years go by. Now, from recent studies in 2014 from the Autism and Developmental Disabilities Monitoring Network, 1 in 59 students will be on the spectrum for autism. Now, what are the risk factors of the autism spectrum disorder? According to DSM-5, there are two risk factors: environmental and genetic. The environmental risk factors include children born to older parents, children born with low birth weight, and while mothers are pregnant, they use valproate, which is a medication used to treat seizures and bipolar disorder. Genetic risk factors include 1 in 5 later born siblings that will develop autism spectrum disorder, and 15% of children with autism spectrum disorder have a genetic basis for the disorder. What are some treatments for the autism spectrum disorder? While there are no cures, there are treatments that help provide structure, direction, and organization for the family. Two treatments include applied behavior analysis and special diets. In applied behavior analysis, the therapists use rewards to support desired behavior and lessen those that can cause harm or block learning. They also teach skills such as listening, looking, reading, and relating to others. Special diets. While there's not a lot of data on this, some special diets avoid foods or substances that might cause problems or allergies, and these diets vary from person to person. Here are the resources I used in my PowerPoint presentation. The Autism Spectrum Disorder ASD retrieved from the Center for Disease Control and Prevention. Wendy Chung, Autism, What We Know and What We Don't Know Yet, and Understanding Mental Disorders, Your Guide to DSM-5. Thank you for watching.